Hi friends, how are you? I hope you all are doing well. Today our topic is Esophageal Pathology Part 2. If you are not subscribed my channel, please subscribe. If you have any doubts, kindly let me know in comment section. So, shall we start? So, in this video, we are covering some pathological disorders of esophagus. First one, GERD. GERD means gastroesophageal reflux disease. Barrett esophagus, Eosinophilic esophagitis, esophagitis, distal esophageal spasm, and esophageal cancers. First one, gastroesophageal reflux disorder. In this disorder, lower esophageal sphincter will relaxes. It decreases the tone. Why? It reflects of acid from the stomach due to reduced lower esophageal sphincter tone. If you see this picture, in this picture, this is the normal condition of the stomach. In diaphragm, you will get esophageal hiatus. In that esophageal hiatus, you will get lower esophageal sphincter. That sphincter will be in physiological condition. It is involuntary condition. When we are swallowing anything, that time only it will automatically through peristalsis movement, it will involuntarily, it will open, then that food content will go to stomach. Then after it closes. But here in pathological condition, what will happen? If you see this picture, in this picture, that lower esophageal sphincter relaxes. Because of that, that stomach content will comes into distal esophagus part. That time we will get acid reflux. So this type of condition we call gastroesophageal reflux disease. Most commonly we are seeing this disease in older than 40 age peoples. Because of that reflex, that esophageal part will be thin. Anatomically, disruption of gastroesophageal junction will be happen. Then one condition will be there. That condition we call hiatal hernia. If you see this picture, in this picture you can observe here, this is hiatal hernia. Between esophagus and stomach, you will get this type of hernia. Means something bulge formation will be happen. So this condition will be happens in GERD. What are the risk factors in GERD? More amount of alcohol consumption, tobacco, obesity, fat-rich diet, pregnancy, and hiatal hernia, and caffeine. This all are comes in risk factors. Now, clinical features. What are the signs and symptoms we can see in gastroesophageal reflux diseases? Heartburn. First point. This is very important. We can see in gastroesophageal reflux disease. Next, regurgitation. Regurgitation means acidic content will comes in mouth. Then dysphagia, difficulty in swallowing. Then odinophagia, means when swallowing pain will come. Next, cough, laryngitis, wheezing, and damage of enamel of teeth we can see, because that acidic content is coming to mouth, right? Then that enamel strength will be reduced. So in GERD, what are the complications we can see? In GERD, esophageal strictures. Then after Barrett esophagus, we will study later. Then after adenocarcinoma will become. So for treatment purpose, we have to suggest diet modification, histamine blockers. Histamine blockers means that drugs will block parietal cells for producing hydrochloric acid. What are the drugs will come in histamine blockers? like cimetidine, ranitidine, nizantidine, famotidine will come in histamine blockers, and proton pump inhibitors. The proton pump inhibitors will inhibit the proton pump like hydrogen and potassium pump. What are the drugs will come in that proton pump? Omeprazole, pantoprazole, ebiprozole, lansoprazole will come in proton pump inhibitors. For surgery we can refer Nissen fundoplication. If you see this picture, in this picture that stomach part, fundus part will be stretched and it folds like this, and that doctor will stitches here. So this is this type of surgery we call Nissen fundoplication. Next, Barrett esophagus. In this disease, if person have long-standing reflux disease, then that person will cause Barrett esophagus. In Barrett esophagus, what will happen? Metaplasia will be happen. Metaplasia means when that acidic content will damaging that esophagus part, then that esophagus part will be have necrosis. Because of that necrosis, there will be happen metaplasia. Metaplasia means the cells replacing. If you see this picture, as I told you before in previous video, the esophagus is made up of non-keratinized squamous stratified epithelium. Actually here that non-stratified squamous epithelium converted into intestinal columnar epithelium, right? In that columnar epithelium you will get goblet cells. That goblet cells will produce mucus. So in Barrett esophagus, metaplasia will be occur in esophagus area, in distal place, right? Where that acidic content will coming, that place will be forms metaplasia. Most common in this disease, most commonly present in white males, and it's typically present between 40 to 60 years old peoples. This Barrett esophagus may progress of dysplasia and adenocarcinoma, right? If you see this picture, this is the normal cells, squamous epithelium, and this is the changes into depleted cells. This is columnar epithelium. In columnar epithelium, you will get more amount of goblet cells, right? If you see this picture, this is the endoscopic structure. In this endoscopic, you can see white patches and red patches. This white patches is the esophageal cells. This red patches, that is we call intestinal cells, that means columnar cells, right? This is the Barrett esophagus. So next we are talking about eosinophilic esophagitis. In eosinophilic esophagitis, it is the like, if you are seeing eosinophils, that means that is the allergic condition. Some allergic is happening there. If patient like asthma or allergic conditions, this type of people we can say eosinophilic esophagitis. In this condition, what will happen? Infiltration of eosinophils in the esophagus, often into the atopic patients. For example, one child have a peanuts allergy. I don't know about that. So that time I gave one chocolate. So in that chocolate, that peanuts, everything mixed. If I gave that guy and that guy ate the chocolate, then he have a conversation, then he have a allergic reaction. Then I admitted in hospital. In that hospital, the doctor told, take endoscopy. In that endoscopy, you will get this type of picture. If you see this picture, you will get ring linear type of structure you can see. If you take biopsy about that cells, you will get this type of eosinophilic cells you will get. It is the In eosinophilic esophagitis, it is typically unresponsive for GERD treatment. It will not respond, right? This is the eosinophilic esophagitis. Next, we are talking about esophagitis. Esophagitis means inflammation in esophagus. Because of gastric reflux, this infection will be occur. This type of disease will come in immunocompromised patients. For example, some transplants like kidney transplant or AIDS or HIV patients, in their body they don't have immunity power. So many infections, bacteria will come in that body. What are the bacteria will affect? First one, Candida. If Candida will affect that esophagitis, you will get white pseudomembrane. If you see this picture, here you can see white membrane. So this is Candida. Next, herpes simplex virus. In herpes simplex virus, you can see punched out ulcers. Punched out ulcers means that ulcers will form in mouth area. Like you can see in side of your lips, your mouth, and inside of the lips, you can see this type of ulcers. Next, cytomegalovirus. That cytomegalovirus will form linear ulcers. Caustic injections or pills are like bisphosphates, for example, are tetracyclines, non-steroidal anti-inflammatory drugs, iron and potassium chloride. These drugs will damage mucosal layer. That's why here prone to forms inflammation. In esophagitis, you can observe odinophagia. Odinophagia means at swallowing time they will feel pain, and they have pain in retrosternal place, means here in this place that patient will feel pain, right? Next, reflex esophagitis. In reflex esophagitis, because of that reflex, that esophagus will cause like esophagus will burns. Because of that burns erosions, you can see like this. When he's swallowing, he will have pain and dysphagia and like some irritation, and when swallowing he will feel that retrosternal angle he feels pain. So this is the esophagitis. Next we are seeing distal esophageal spasm. In distal esophageal spasm, it is uncoordinated with contractions. Because of uncoordinated contractions, we can't see peristalsis movement. Because of that, esophagus will contract very much. If you see this patient, he will come to hospital like he have a dysphagia and angina like pain. Angina like means like heart attack type. He will feel pain, right? For imaging, if you give barium for swallow, that patient esophagus, we can see like this, like corkscrew. This, if you seeing this image like corkscrew type, we can see here. And another, for permanent diagnosis, for complete diagnosis, we can do manometry. Manometry means one catheter they insert through nasal cavity. From nasal cavity to they will insert to your esophagus. In that catheter, they have some sensitive parts. In that, when that catheter will passing to the distal esophagus, in that esophagus, that sensitive parts will observe how much that lower esophageal sphincter will closing, how much pressure that lower esophageal sphincter will passing movements, we can see in that manometry. Next, for treatment, we can give nitrates for vasodilation, and we can give calcium channel blockers. Because because of more amount of calcium, that action potential is increasing, that action potential tone will increasing. That's why that esophageal contracts. That's why we can block calcium channel blockers. So that's why we can block calcium channels. So this is the distal esophageal spasm. Next we are going to see esophageal cancer. Esophageal cancer. Esophageal cancer is divided into two parts, like small cell carcinoma and adenocarcinoma. Small cell carcinoma. If you see small cell carcinoma, it is most common in worldwide. This cancer caused in upper and middle part of the esophagus. What are the risk factors we can see in this small cell carcinoma? More amount of alcohol and tobacco, drinking very hot tea, achalasia, esophageal web, for example Plummer-Vinson syndrome. In Plummer-Vinson syndrome, we studied before, we can see three types of sign and symptoms like dysphagia, iron deficiency, and esophageal web. And esophageal injury. This esophageal injury will forms example like ingestion. This small cell carcinoma affects because of nutritional deficiency and eating of polycyclic hydrocarbons, nitrosamines foods. In that food they will add nitric oxide and other mutagenic compounds such as those found in fungus contaminated foods. Fungus contaminated foods means, for example, vegetable pickles, like normal pickles will comes in this fungus contaminated foods, and must also consider in small cell carcinoma. If you see this image, this is the upper middle part of esophagus. In that part here, that small cell carcinoma formed and it's blocking that esophagus part. If I see the biopsy test, you can observe this type of histological structure. In this histological structure, you can see keratin nests are pale within the tissue or organ. Next, if you see the outer structure of esophagus, you will get this type of structure in small cell carcinoma. Next, we are going to see the adenocarcinoma. Adenocarcinoma of esophageal cancer. In adenocarcinoma means it is malignant proliferation of glands. This type of cancer is mostly present in America. Before this adenocarcinoma, we can see pre-existing like Barrett esophagus, chronic GERD, obesity, smoking, achalasia. They will have this adenocarcinoma cancer. Usually it's present in lower 1/3 of the esophagus. That means it's present in distal part. If you see this esophagus, in this esophagus, in outer structure of esophagus, you can see this type of structure, right? In biopsy test, you can see this type of cells. This is the esophageal cancer of adenocarcinoma. So today we discussed about GERD, Barrett esophagus, Eosinophilic esophagitis, distal esophageal spasm, and esophageal cancers. If you like this video, subscribe my channel. If you have any doubts, let me know in comment section. If you want notes, I will say Telegram link in description. Please join the channel. You will get that notes. Thank you.